If you feel like you have chubby, round cheeks no matter your weight, and you want to know how to slim the lower part of your face, this video is for you. I'm Dr. Paul Pearce, a plastic and reconstructive surgeon here in Austin, Texas, and let's get into it. So why do you have chubby cheeks? Your chubby cheeks can be a result of two different things. One, your weight, or two, your buccal fat pads. Now, your face needs fat in it in order to give you a youthful appearance. However, too much fat in certain places can give you an overall rounded appearance to your face. And as you lose weight, you also lose weight in your face. And that can help reduce the appearance of chubby cheeks and give you a little bit of a slimmer profile. However, if you have a normal weight and you've had a round face all your life, it could be your buccal fat pads that are the reason. So what are the buccal fat pads? The buccal fat pad extends from the temples down to the lower third of your face and provides some cushioning between the muscle groups in your face. Depending on the size of this fat pad, it can also cause the lower third of your face to round out, giving the appearance of a fuller face than what you may actually want. So why do we want to remove the buccal fat pads? Well, every culture has its own definitions of beauty and what makes someone attractive. In Western society, a defined jawline and a more angled appearance are associated with youth, beauty, and attractiveness. You see it all the time in leading men and women in the movies and fashion models. The strong jawline, the angled faces with great cheekbones, features that a lot of us wish we had from time to time. These are also features you may also determine if you swipe left or right on a certain dating app or two. But by removing these fat pads, it reduces the volume of the lower third of your face, producing more definition in your cheekbones and can help define the jawline better. There's also some evidence that it can help soften the appearance of your jowls since it's removing volume just behind the area where the jowling occurs. How is the surgery done? Buccal fat pad removal can be done under general or local anesthesia. If you're having other procedures in combination with a buccal fat pad removal, such as liposuction of the lower face and neck, we would discuss doing this procedure in the operating room. However, if you are a good candidate, and the majority of our patients are, we typically do this procedure under local anesthesia in our procedure room. The procedure is done through a tiny incision on the inside of the mouth, and the fat is pulled out through this incision. The wound is then closed with some absorbable sutures, and then a compression dressing is applied. How long does recovery take? Well, there's not a lot of downtime for this procedure. Swelling tends to be about 1 to 2 weeks post-op, and typically patients, depending on what they do for work, can be back at work the next day if they're working from home, or they may need to take about a week off if their job requires a lot of face-to-face interactions and they want to be discreet about the procedure that they just had done. All of my patients go home with a compressive dressing that I advise them to wear night and day for a few days after the procedure. Pain is minimal post-op, and patients go home on some oral pain medications and antibiotics. I also ask my patients to stay on a liquid diet for about 24 hours after the surgery, and then they can begin a soft diet, which they stay on for about 7 days before going back to their regular diet. The sutures we place are all absorbable and will dissolve on their own, so nothing to take out. How long till I see the full results? Well, early results can be seen about 2 weeks after the procedure, but typically you can expect full results around 6 months after all the swelling finally subsides. But the one thing to keep in mind with these results is that the final results are subtle. This is not going to create a dramatic change to your appearance. You'll notice the slimming effect for your procedure, and your friends may ask you if you lost weight, but they aren't going to immediately ask you if you just had your buccal fat pads removed. The results that you do get are permanent, and contrary to popular belief, this procedure does not hollow out your appearance or make you look older afterwards. It's just not possible with the amount of fat that we're taking out since the fat pads are relatively small in size. So if you were thinking about getting a slimmer profile for your face, then buccal fat removal might be for you. However, buccal fat removal is sometimes just a part of the entire process for slimming the lower third of the face. So if you really want to see how we can achieve an entirely new look for your neck and jawline, check out this video on lower face and neck liposuction. I hope you all enjoyed this video, and if you learned anything, give it a thumbs up or share it with your friends. I'm Dr. Paul Pearce, and we'll see you on the next one.